just in one day, it's back. My hand, I couldn't open my hand, I can open my hand. I can feel my feet. I have no pain. I've had pain for 5 years in my neck.
This Christmas will be different because my wife walks. This Christmas will be different because my wife has a lot more energy. We're able to go out in the evenings and spend time with family. Liberation procedure, go for it.
It is fantastic. Come to Costa Rica and get that operation done now. I've never seen medical treatment like this in my life before.
Hello, my name is Jennifer Reimer, and first and foremost, I'm the wife and support person of a 34-year-old man with primary progressive multiple sclerosis. Like many of you, in November 2009, I started scouring for information and research for the best comprehensive treatment program for testing and treatment of CCSVI. I couldn't imagine my husband traveling 20 hours on a plane ride due to his muscle spasms and his stiffness. I couldn't fathom him experiencing extreme fatigue from a huge time change. That is when the Passport Medical program caught my eye, mostly due to its tropical location and close proximity to Canada. After thoroughly researching the credentials of the vascular team, the high standard of medical care at Hospital Clinica Biblica, and the intense physiotherapy team that was a part of this package, our treatment decision was made. It was the best decision of our lives. My husband saw some immediate and miraculous improvements, and over time and working through the physiotherapy program, his body was doing things that we haven't seen him do in years. As a person with primary progressive multiple sclerosis, he's still able to say he feels better than he did 6 months ago. That is why we're creating this video as a guide to help you through the steps of your journey to liberation through Passport Medical. We hope this will be helpful to you, the patient, in knowing exactly what to expect from your arrival at the airport, through the testing and treatment process, as well as your physiotherapy and your preoperative care. As you come out of the airport, look for a sign with your name. Upon arriving in San Jose, Costa Rica, you will be met outside customs by an English-speaking representative from Tropical Expeditions of Costa Rica. If you have requested wheelchair assistance through the airline, they will assist you through immigration, customs, and to the baggage carousel. If a wheelchair or scooter has been checked, it will be located in the oversized baggage section. Costa Rica. Often referred to as the land of eternal spring, Costa Rica is a tropical destination filled with friendly people and boasting a long democratic tradition. From smoldering volcanoes to lush rainforests and picturesque beaches, North American travelers in particular have made Costa Rica a popular ecotourism destination. However, stunning beauty is not all that Costa Rica has to offer. Costa Rica has no army. Instead, it has focused its resources on education and healthcare. It is one of the region's leading technology exporters, and you might even be surprised to know that the World Health Organization ranked Costa Rica's healthcare system as one of the best in Latin America, one notch ahead of the United States.
It's been a wonderful experience. It's been wonderful to meet people that have been in the same place that I have been, that understand what the brain fog is, the pain, the fatigue. I had no peripheral vision. It was just a really, really ugly life that I was living or trying to survive. So when we got here, I talked to other people that were waiting for their surgery time, other people that had done it, and it was very positive. I had no fear. The hospitals are incredibly clean. Everyone is supportive. Everyone loves to tell their story. They're all happy stories. There are all kinds of emotions in everyone. I went to the surgery. The nurses, the caregiving was amazing. I don't remember the surgery at all. When I came back from recovery, I had feeling in my right hand that I hadn't had for years, and it was just an amazing emotional experience that's really changed my life. It's taken me from survival back to living, and I look forward to everything. Everyone has been wonderful. The weather's been great. There's not enough positive that I could say.
You will be assisted with hotel check-in at a private check-in desk at the hotel. You will be provided with a welcome package which provides important information and an itinerary for the week. You will also be shown the Passport Medical Desk, where our 3 employees are available for assistance 7 days a week. This is the location where we post patient appointments and schedules, so please make sure to come by regularly. The Passport Medical staff is there to help you with your every need. A nurse is on duty at the hotel to check your blood pressure, take your temperature, and monitor post-operative recovery. You will be informed of the time you need to be in the hotel lobby for your transportation to the hospital. Hospital Clinica Biblica was originally founded over 80 years ago. This private hospital is a premier modern medical facility, one of the finest in all of Latin America, and one of the first Latin American hospitals to be accredited by the Joint Commission International, the highest standard in international healthcare, which certifies over 18,000 hospitals in the United States. As a Joint Commission International accredited hospital, Hospital Clinica Biblica has achieved the gold standard in international healthcare, one of the few hospitals performing CCSVI Liberation that has this designation. JCI accreditation is considered the best benchmark to use when researching foreign hospitals. Hospital Clinica Biblica is a member of the Medical Tourism Association. Hospital Clinica Biblica is also a member of the Council for the International Promotion of Costa Rica Medicine, ProMed, the private non-for-profit organization that helps ensure quality services provided by the private health industry in Costa Rica. The recovery center, where patients stay for the duration of their journey, is the Hilton Doubletree Carriere, which is working to become the first of its kind to also be certified by ProMed.
Hi there, my name's Carol Tremblay. This is my husband Roger. He has had MS for over 25 years now. And we are in Costa Rica, which is fantastic. Roger had his procedure on December the 6th, and 2 days later he stood, and that was just wonderful. And he also could only put his arms up to here, and put your arms up, Raj, way up, way up. Isn't that fantastic? And he had brain fog, which is gone now, and that's wonderful. Any little thing helps. But we just can't find the words to say enough about Passport Medical. They're just fantastic. They're so caring, and the hospital staff, everybody, we just can't say enough about them. The physiotherapy is fantastic. Without that, I don't know where we'd be. I think a lot of the other countries don't do physiotherapy, and it's fantastic. It really makes a difference, and we're just hoping and praying that when we get back to Canada, back to Ontario, that we can get physio, but I'm sure we can, but not nearly as good as the physio here.
A representative from Tropical Expeditions will bring you from the hotel to Hospital Clinica Biblica for your pre-op testing and treatment. You will be greeted at the hospital entrance by a member of the International Department. Led by brothers Brad and Bill Cook, Hospital Clinica Biblica's International Patient Department is recognized by many in the medical travel industry as one of the best in the world. Here, you will be in the caring and capable hands of a group of highly trained bilingual patient coordinators who will personally assist you throughout your stay at the hospital. Both Brad and Bill are frequent speakers and educators at international conferences and hospitals, promoting the importance of creating a safe and stress-free international patient experience.
Hello, my name is Brad Cook. I'm the director of the International Department for Clinica Biblica Hospital in San Jose, Costa Rica. I've been here for about 15 years running the International Department. We have a great program in medical tourism. We have patients coming from all over the world, especially North America, for procedures here at our hospital. We have a team of coordinators and really just a great program going on here. So we really love to have you visit us. And I'm going to let Bill go ahead and talk a little bit more about what our program is and some of the details of the program.
Hi, my name is Bill Cook, and I'm the Operations Manager for the International Department here at Hospital Clinica Biblica. My job is really to make sure that your whole experience is stress-free and as pleasant as possible. So I work with our coordinators to make sure from your airport pickup to your arrival at the hotel, to your preoperative exams here at the hospital, the surgery, therapy afterwards, everything goes as planned. So really what we've seen has been really incredible, the results we've seen, and really just welcome you to our program, and I look forward to seeing you back here in Costa Rica.
International staff representatives will escort you briefly to admissions and then to your private room where much of your preoperative testing will be done. This includes blood work, a Doppler ultrasound, an EKG, a neurological assessment, as well as signing hospital consents and medical forms. You will also be met by an intensive care doctor who will review your medical history. You will be given a private room, which includes air conditioning, a cable TV, a safety box, and a futon bed for your companion. At any time during your stay, there will be nurses or staff from the International Department available to assist you. You will be given an IV and instructed when to start fasting. A nurse will let you know what time you will be brought down for the treatment. The entire treatment process usually lasts 2 to 4 hours. Some of the unique aspects of our program include unlimited balloons, whereas many other programs charge between $800 to $1,200 for extra balloons. Both jugular veins, the azygous vein, and vertebral veins are ballooned during the same procedure, which is all included in the package price. A larger sized balloon is also being used, which is thought to significantly reduce the risk of restenosis. Although the risk of complications is very small, another great feature of this package includes a $10,000 complication fund in the event that additional medical assistance is required due to complications with the angioplasty. The blood-thinning medication, Clexane, or the Canadian equivalent of Lovenox, is considered to be the superior medication used to decrease the risk of post-operative clotting and stress to the veins. This is viewed by the medical community as a much superior medication to aspirin or warfarin, which are being used by some other programs worldwide. 2 weeks' worth of the medication is included in the package.
Hi, we're Roland and Tammy Deshane. We're from Carsland, Alberta, just outside of Calgary. And we've come down from Canada to have Tammy treated. Tammy's had MS for a number of years, and we heard about this treatment on Canadian television. We were expecting to come down to a good hospital, but our expectations have been exceeded. This hospital is cleaner, newer, and more modern than just about anything we've seen, and certainly compared to some of our American friends have commented that they have never seen a hospital like this. The staff have been very friendly. They've told us through every step what to expect, and the treatment has, I think, worked fairly well already. We're seeing the first signs. Tammy's got way more energy than she ever has, so we're hopeful that the improvements will continue to flow. No pun intended. But we're expecting that certainly that this was a worthwhile venture, and we're happy we came.
The surgical team of 5 vascular surgeons and 1 interventional cardiologist, led by vascular surgeon Dr. Marcial Fayas, have performed, as of January 2011, nearly 400 balloon angioplasty liberation procedures. They continue to develop one of the most thorough treatment protocols for CCSVI testing and treatment around the world. Dr. Fayas and his team have been involved in numerous international CCSVI conferences, including those held in Boston, New York, Frankfurt, and Scotland.
Hello, I'm Dr. Fayas. I'm just one of the vascular surgeons that it's part of the program of CCSVI in Costa Rica. I would like to explain you a little bit about the procedure that we are doing. What we are trying to do is just to open the veins. Normally, the procedure that we are doing is just with balloons. So to do that, we are using the access through the left groin, and from there we go to check up the veins, the iliac veins that are the veins in this area. That's because we try to find if there is an occlusion of the vein in this area. So from there we go through the vena cava and go to the neck to check up the jugular veins in right and left side, and from there we go to the chest and check up the azygous vein, that it's one of the other veins that it's being described that has some problems in the CCSVI. So this is the circulatory system. It has different parts. We have the heart that is like a pump. We have the arteries that in this drawing are the red ones. And we have the veins that they have to take the blood that it's going to every part of the body through the arteries. The veins have to take this blood back to the heart. So that's where we do the entrance in this area. So from there we go and check up especially this part. As you can see, when the artery that it's going to the right leg is crossing over the vein that is coming from the left leg. So we have found some occlusions in this area. That's what it's called, the May-Turner syndrome. So after that we go through this vein and we go to the neck and we check up this vein that it's the jugular vein and also the small one that it's the vertebral vein. So from there we go to the chest and we check up a vein that it's just in the back part of the chest. It's not in this drawing, but it's called the azygos vein. So if we find any lesion in one of these veins, what we try to do is just to open with a balloon that we will inflate, and after that we deflate the balloon and take it out of the body.
For your recovery, you will remain lying down for a period of several hours. Nurses will be monitoring you and are always available for assistance. Some patients may experience immediate results, while others, improvements may take a little more time. You may feel groggy from the anesthetic and a little sore from the angioplasty. You'll be discharged from the hospital around 3 p.m. the following day. A Tropical Expeditions representative will escort you back to your hotel to continue with your recovery.
Hi, my name is John Reed. I'm from Newfoundland, Canada. I have secondary progressive MS. I didn't have any intention of ever getting in front of a camera when I came here, but it was hard for me not to do it after I had the procedure. So I decided I should come down and tell somebody about it because I think it's important for people to realize that this procedure is life-changing and it's painless. And you know, when you got MS, I didn't have any hope for 9 years. My sister Mary was down here in August and she had the surgery and she went from a wheelchair of 8 years to walking, you know, with canes and everything. So before I only had to look to a wheelchair. That's what my gauge was. About my sister, she's older than me and she was in a wheelchair, so that was my future. But then along came liberation treatment and it works, you know, there's no doubt, because I can feel everything. My balance just in one day is back. My hand, I couldn't open my hand, I can open my hand. I can feel my feet. I have no pain. I've had pain for 5 years in my neck and it's gone. And I don't know, I don't think that's any accident. I think it's just because, you know, they're on the right track. And the highest praise to Passport Medical for putting it all together down here in Costa Rica. Is absolutely a fantastic feeling. To see all the people out there and hear their stories before you have the procedure is enough to give you hope and that. And when you wake up, it's just totally amazing. I can't help it. It's, you know, I can walk, I can open my hands, I don't feel pain. I'm just excited about the whole thing. And maybe, you know, by me speaking out, maybe it can help someone else, and that's what it's all about for me. So hopefully, you know, everything works out for everybody the way it's working out for me. That's about all I can say.
One of the most unique and valuable components of our CCSVI package is the remarkable physiotherapy and rehabilitation program, led by therapists Gabriela Chinchilla and Claudio Carrizo.
Hi, my name is Gabriela Chinchilla. I'm one of the coordinators for the physical therapist team for CCSVI program in Costa Rica. The idea in here is that you come and after and before the surgery you have a good start of the exercises that you need to keep doing after the surgery. We want it to be a good start so that you know exactly which things you need to work in. You're always going to be working with one physical therapist, and we try to do it as more individualized as we can. There's always going to be someone working with you in exactly what you need, and the idea is that you come here, you have the surgery, and after that, you start working in the getting yourself better, getting more strength in your muscles, more abilities, more coordination, more balance, and all the stuff that during the years you have lost, so that you go back home and you know exactly what you need to work in. I think we're the only program for the CCSVI surgery that includes therapy, and we have had a great experience doing that. People have been having fun here at the gym and at the pool, and I hope that you can enjoy if you decide to be part of this program.
The physiotherapy has been phenomenal. They are very, it's not just stretches, they make you work. And it's working so well for me. Like I said, 5 minutes on a treadmill when I haven't walked since the summer. It's amazing. It really has been amazing. And they really know what you're doing. I'm learning new things. My husband videotapes us every time so he can learn what he needs to do when we get home. It's giving us tools to be able to have a better quality of life. And that means the world, so we can take it home with us, go to the gym, we can learn. And I know what to do now.
They are highly trained in vascular and neurological health, assisting patients with post-operative stress, working towards improving blood flow, brain-to-body messaging, relaxation, and sensory techniques. The patient testimonials we receive on a daily basis are overflowing with praises about the many benefits they have received through the physical therapy. You will receive 8 to 10 therapy sessions ranging from 60 to 75 minutes depending on patient needs. Patients are encouraged to maintain this program upon their return home. A few days prior to departure, you will be taken to your post-operative consult with the surgeon. A post-operative ultrasound will be done and your symptoms will be reviewed. A Tropical Expeditions representative will transport you from the hotel to the airport for your return flight home. One of the most difficult parts of this journey will be the goodbyes. I think you may be surprised at the intense family atmosphere and bond that develops when patients and their support people gather to share their successes, struggles, and stories. Words cannot describe the relationships and long-term friendships that are formed.
Hi, my name is Byron Jacobs. I'm from Hamilton, Ontario, Canada. And there's a couple of things I want to say about this whole thing today. One is I'm sold out completely to the liberation procedure. And I'm also sold out to the liberation procedure through Passport Medical. I don't have MS. My wife does. My wife has primary progressive MS. And about a year ago, we heard of the liberation procedure. And then a number of months ago, we heard about Costa Rica and the CCSVI procedure. And we came here with the idea of having liberation treatment done, having these veins opened up and seeing what would happen. We came in with a lot of hope. We're on the other side of it now, 4 months from the procedure. My wife is actually walking with a walker, using 2 canes at times, and from time to time, she'll walk across the house with nothing at all other than someone by her side. That's in 4 months. In the 4 months, she's seen the catheter that she had for 5 or 6 years has been taken out and gone. Now, let me say a word about Passport Medical. We connected with Passport Medical not knowing them at all. We were given the name of a young lady, Jennifer, and from there the connection was made, and everything just seemed to proceed so well. Couldn't say enough about the expertise of the company and what they've done for us. They've done so much for us, we've come back for a second time. I'm here with my brother-in-law. My wife's brother has MS as well. And we're here to have this procedure done again and believing it to be a great success. The facilities here are wonderful. The hospital is world-class. The doctors, world-class. And all of the care you get, world-class. Again, I'm sold out to 2 things. One is the liberation procedure does work, and number 2, a good company to go through is Passport Medical. Congratulations to all those who've had liberation procedure done. To those who are considering it, thumbs up all the way, 100%, go for it, do whatever you have to do to have it done. For my loved one, my wife, my partner of 31 years, this Christmas will be different. because my wife walks. This Christmas will be different because my wife has a lot more energy. We're able to go out in the evenings and spend time with family. Liberation procedure, go for it.
Passport Medical is a Canadian medical tourism company that facilitates the contact between patients and medical providers. Passport Medical is a member of the Medical Tourism Association, a body whose aim is to promote the highest level of quality health care to patients in a global environment. In addition, Passport Medical is accredited by the Better Business Bureau. Unlike other medical companies sending people for CCSVI treatment, Passport Medical has worked with Hospital Clinica Biblica in Costa Rica from the very beginning to develop what we believe is the most comprehensive program for CCSVI anywhere in the world.
I can walk. I can see. And it's very emotional.
Passport Medical has coordinated more CCSVI liberation procedures than any other company in this world to date. In addition, the CCSVI program is now completely run by those affected by this debilitating disease, who have been through the program through their own experiences. Why choose Passport Medical? Experience. Over 400 liberation treatments as of January 2011. Positive results. Hundreds of patient testimonials. 6-surgeon team supported by multidisciplinary medical staff. 13-day program including physiotherapy. Minimal waiting time for scheduling procedures. Unlimited balloons and ballooning the azygos, the jugulars, and vertebral veins. Medical complication coverage. Passport Medical team available at the hotel 24 hours a day, 7 days a week. JCI accredited hospital. No language barrier. Beautiful tropical destination. Close proximity to Canada.
I just want to say thank you to Passport Medical first and foremost. I'm not a paid actor. I get nothing out of this. I'm just doing it for the betterment of all of you guys out there watching who are suffering with MS. I urge you, beg, borrow, or steal the money to come over here to get that treatment done. It's a miracle. And then I started Facebooking, researching, doing all the necessary things that I had to. Decided that Costa Rica was where the gold standard was. There's 6 vascular surgeons currently doing this procedure in Costa Rica. Some of the finest medical staff. And I noticed, I was scared going in, but I really noticed benefits coming out like crazy. Suddenly, I could feel my feet again, like you've heard a million times before but it's true. You do not feel cold feet. There was no tingling going up and down my shoulder. My legs, there was no pins and needles. I'm currently receiving physiotherapy every day, which is probably the hardest part of the procedure, and no other country in the world, I think, is offering the physiotherapy. That may be a good thing why you are going to decide to come out here to Costa Rica. It's just for the physiotherapy. The hotel that I'm staying in, the medical staff, the hospital, the people of Costa Rica, they're fantastic. I urge you, as a Canadian citizen, and I was born in South Africa, I've never seen medical treatment like this in my life before. It is fantastic. Come to Costa Rica and get that operation done now.
We've provided you with an in-depth review from a patient's arrival to their departure, including statements on the impact from past treated patients that this program has had. I hope that you'll find this video very helpful on your journey towards liberation. The staff at Passport Medical and Hospital Clinica Biblica look forward to talking with you soon. Thank you so much and have a great day.